Herniated disc causes and symptoms. A herniated disc is a common condition that can be painful and debilitating. People also refer to it as a slipped disc or disc prolapse. In some cases, it can lead to pain, numbness, or weakness in the limbs. However, some people experience no pain, particularly if the disc does not press on any nerves. Symptoms normally reduce or resolve after a number of weeks, but a person may need surgery if they persist or get worse. Treatment. Herniated disc might cause severe pain, but the right treatment can relieve symptoms. A person can mostly resolve symptoms by avoiding movements that trigger pain and following the exercise and pain medication regimens that a doctor has recommended. Treatment options include medication, therapy, and surgery. Physical therapy. Physical therapists can help find positions and exercises that minimize herniated disc pain. Therapists may also recommend treatment with heat or ice. Ultrasound, which uses sound waves to stimulate the affected area and improve blood flow. Traction, which can alleviate pressure on the affected nerve. Short-term bracing for the neck or lower back to improve support. Electrotherapy, as electric impulses might reduce pain for some people. Surgery. If symptoms do not improve with other treatments, if numbness persists, or if bladder control or mobility worsen, the treating doctor might recommend surgery. In most cases, the surgeon removes only the protruding portion of the disc. This is an open discectomy. The surgeon will usually conduct open discectomy using a laparoscopic technique, opening a small hole in either the front or back of the spine. This technique avoids the need to remove small portions of the vertebra or to move the spinal nerves and spinal cord to access the disc. Artificial disc replacement. Surgeons have carried out disc replacement procedures since the 1980s in Europe, but are not yet available in the United States. There are two types. The first is a total disc replacement. The second is a disc nucleus replacement that involves replacing only the soft center of the disc known as the nucleus. Artificial discs are metal, biopolymer, or both. A biopolymer is a substance similar to plastic. Causes. A slipped disc occurs when the soft internal section of an intervertebral disc protrudes through the outer layer. The human backbone or spine consists of 26 bones called vertebra. Between each vertebra lie rubbery, cushion-like pads called discs. These discs help keep the vertebra in place and act as shock absorbers. Spinal discs have a soft, jelly-like center and a tougher exterior. A herniated disc occurs when some of the soft interior slips out through a crack in the wall of the disc. This most commonly occurs in the low back but can also occur in the vertebra of the neck. The escape of this jelly is thought to release chemicals that irritate nerves in the surrounding area and cause significant pain. The prolapsed disc may also put pressure on nerves and cause pain through compression. The cause of a leaking disc is usually gradual and overuse as a result of repeated movement over time. Spinal discs lose some of their water content as a person ages. This reduction in fluid makes the discs less supple and more prone to splitting. It is not always possible to recall the exact point when a disc problem begins, but it often occurs when lifting objects without bending at the knee or after twisting while lifting a heavy item. Risk factors. Herniated discs can occur at any age, but they are most common for men between the ages of 20 and 50 years. Factors that increase their likelihood include weight. Being overweight puts additional stress on the lower back. Genetics. A person might inherit a predisposition to herniated discs. Occupation. Individuals with physically demanding jobs or pastimes that involve pushing, pulling, or twisting are prone to herniated discs. Any repetitive activities that strain the spine can cause them. Unsafe lifting technique. People should always apply force from the legs, not the back. When lifting heavy items, incorrect techniques can lead to a herniated disc. Driving often. A combination of being seated for long periods and the vibration and movements of the car can damage the disc and spinal structure. Sedentary lifestyle. A lack of exercise can lead to a herniated disc. Smoking. This might reduce oxygen supply to the disc and lead to a grinding down of the tissue. Symptoms. In some cases, a person will have no symptoms. If symptoms occur, they are often due to pressure on the nerves. Common symptoms can include numbness and tingling. This occurs in the region of the body that the nerve supplies. Weakness. This tends to occur in the muscles linked to the nerve, which may cause stumbling when walking. Pain. This occurs in the spine and can spread to the arms and legs. If the herniated disc is in the lower back, the pain often affects the buttocks, thighs, curves, and possibly the feet. This is often referred to as sciatica because the pain travels along the path of the sciatic nerve. If the problem occurs in the neck, the shoulders and arms normally experience the pain. Quick movements or sneezing might induce shooting pains. Complications. Below the waistline, the spinal cord separates into a group of individual nerves, collectively called the cauda equina or horse tail. In rare instances, a herniated disc can compress this entire set of nerves. This can cause permanent weakness, paralysis, loss of bowel and bladder control, and sexual dysfunction. If this occurs, emergency surgery is the only option. Seek medical advice if there is any bladder or bowel dysfunction, the weakness progresses and prevents normal activities. There is increasing numbness around the inner thighs, the backs of the legs, and the rectum. Prevention. Tips for preventing a herniated disc include avoiding obesity or losing weight if necessary, learning the correct techniques for lifting and handling, resting and seeking help if symptoms occur. Although it can sometimes be extremely painful, a herniated disc has many promising treatment options.